this is when treating the adrenals does not help an adrenal problem. And this is more common than you think. You know, one of the first things I learned about when I was in practice was that how many people had adrenal stress problems. You really don't learn that until you get in practice. You're a student, you maybe learn about adrenals, but you really don't realize how common it is. How many people would you say in your practice, how many would you say had 50% or more of your patients had adrenal stress-related problems? Yeah, everybody, right? In some practices they say 80 or 90%, and I've never had anyone say less than a third of their patients had adrenal stress problems, and it's always 50 to 80, 90%. So most of them respond pretty well, but some of them just don't respond. They're always tired. They're always dragging. You treat them, you give them adrenal this, you give them herb that, you give them vitamin this, you treat this circuit, you treat the then they just never really get over the hump. Maybe a little better for a while and down again. In those patients, what we've learned in the last few years is treating the adrenals is not the problem. The problem originates because when there's inflammatory process, remember we talked about the hypothalamus. At the hypothalamus, the blood-brain barrier is at its thinnest. And so cytokines can readily get into the hypothalamus. When the cytokines get to the hypothalamus, inflammatory cytokines, they impact the hypothalamus area called the paraventricular nucleus, which is the area for the HPA axis that drives the adrenals. So under cases of inflammation, the hypothalamus is affected. The adrenals, they may be fine. They may be functioning just fine, but they don't get the message from the hypothalamus because the hypothalamus is shut off, so it doesn't stimulate the pituitary, so it doesn't stimulate the adrenals. So it's like brain on fire in the hypothalamus, and adrenals are fine. They're doing just what they're being asked to do. They're just not being asked to do their job. So let's talk about that a little bit.